Hey, lovelies, welcome back to my channel. If this is your first time here, you're most welcome. Please go on and press the subscribe button so that you get notifications every time I upload a new video. And then if you are a returning subscriber, thank you so much, and keep on recommending this to your friends, to your family, and everyone whom you feel will need this. Okay, my baby welcomes you. Hi. Okay, let's start off quickly. So we're going to go through the intramuscular injection, and we're going to go through the assessment criteria, and then we also go into the how to. Okay, so right here is the marking criteria that I'll be reading out for you, and then we go into the how to. If you have any questions, if you want clarity on anything, please comment in the comment section and let me know what you think, okay? Or what you need to know more about anything, okay? Okay. The assessment criteria for the intramuscular injection. Number one, explains the procedure and gains consent. Before administering the prescribed drug, looks at the person's prescription chart and correctly verbalizes all the following correctly. The person, you check the person's ID with their date of birth and the hospital number against their wristband, which is usually white. Then you go on to check the drug. Is it the right drug? Is it for the right person, the right dosage, the right date, the right time, route of administration? Is the person not allergic to this drug? Okay. Then correctly checks and verbalizes the following: validity of the prescription, signature of the prescriber, is the prescription legible? If any of these pieces of information is missing and clear, the midwife should not proceed to administer continue to administer the medication. I think I showed you the drug chart yesterday, how it looks like. It is still here. Still another copy is here. Do you see this? So this is the IM injection. So when you go in, this is the drug chart. Just as I told you, when you begin with a surname, forename, here, date of birth, hospital number. You go on to the head, right? You have to read everything of this, okay? Then you check the prescribers. Who is the prescriber? What's their GMC number? And what's their signature? And what's their blip number? Then here is the person who is giving the medication, who is administering. So you, the candidate, you write your name here, then your initials, your signature, and the base. The base is where you are. Is it in labor ward? Is it in antenatal? Is it in postnatal? Wherever you are is what you write. Okay. Then 4, cleans hands with alcohol hand rub. All washes with soap and water and dries with paper towels following the WHO guidelines. 5A, assembles the equipment required in a safe manner. 5B, draws up betamethasone accurately using the filter needle. Okay. We said you should also look at the drugs that we commonly give, that are commonly used during the examinations. So we all know that, at least know the drug and know why it's given, and you know its dose, and you know its route, and know the side effects at least. So we all know betamethasone helps with the baby's lungs. Okay, so then we go to 5C, replaces the filter needle with a 21G needle in preparation for administration. We know that the borehole needle is big. like for drawing up the medication, and then the one that you use for administering the medication is different. I wish I had a copy. I think I'll try to do also a video about that and see if I can clarify on that. Puts on a disposable plastic apron and gloves, removes the appropriate garments to expose the injection site. Okay, verbalizes the injection site for any signs of inflammation, edema, or infection. Okay, verbalizes checking the cleanliness of the injection site, states that there would be no need to clean if the site is clean, but if required, I would clean with a sub saturated with 70% isopropyl alcohol. Okay, and stretches the skin around the injection site. This is the stretching, like if this is where you're going to give the injection, so you stretch like this. So inserts the needle at an angle of 90 into the skin until about 1 centimeter of the needle is left showing. Let's say this is the needle. So let's say you are in, let's imagine this is the plunge. So if 1 centimeter like this, so which means the rest of it should be inside there. So then depresses the plunger. This is the plunger at approximately 1 mil for every 10 seconds when you're giving the, when you're pushing in the medication. So this is the 1 centimeter. I don't know if this pen can show it clearly. And injects the drug slowly. Like if it's 5 mils, you're going to go 1, 2, 3, 4, 5. Okay, and waits for 10 seconds before withdrawing the needle. That is after you've pushed the medication, then you wait for the 10 seconds before withdrawing the needle. Okay, so sorry about that, I call interrupted the video. So withdraws the needle rapidly and applies gentle pressure to any bleeding point that does not massage the site. Okay, then applies a small plaster over the puncture site. 15, ensures that all sharps and non-sharp waste are disposed of safely. 16, remember to not recap your needles. Okay. 16, cleans hands with alcohol hand rub or washes with soap and water and dries with paper towels following WHO guidelines. 17, records the date and time of administration and signs the prescription chart. 18, acts professionally throughout the procedure in accordance with NMC 2018, the code, Professional Standards of Practice and Behavior for Nurses and Midwives and Nursing Associates. Okay, so basically that's it for the marking criteria. So now we are, for those who do not have a scenario, should I read for you one? Okay, I'm going to just give you an example of 2 scenarios that you may get in the for this, and it's 12 minutes. Remember to complete this section, so try to use the scenario and time yourself for 12 minutes and see if you can complete this. Remember, you have to read the scenario carefully, do what you're supposed to do, and make sure you document. Don't forget to document, sign, and date. Okay, even if you do everything and forget to document, you will be marked wrong. Okay, so example 1, maybe you're working in the birth center. You are caring for Jamira, who is in active labor. She has been using Entonox for the last 2 hours, but is now requesting for something stronger as contractions are becoming more frequent and painful. She had 50 milligrams of cyclizine at 6 due to nausea and vomiting. So it's now 8, and you are required to administer pethidine hydrochloride as prescribed according to the current evidence-based practice. Okay, All the equipment you need is provided. You are required to complete the document provided to you during the skills station, and you have 12 minutes to complete this station. Okay, so another scenario. You are working in the maternity triage. Jamila arrives with a history of contractions. This is her 4th pregnancy, and she is 34 weeks of gestation. She has a history of preterm labor. She has been reviewed and has been prescribed betamethasone for threatened preterm labor. Okay, please perform administration of betamethasone via intramuscular injection route according to current evidence-based practice. All the equipment you need is provided. You're required to complete the document provided to you during the skills station, and you have 12 minutes for this station. Okay, so here they're telling you, talk to the person, please verbalize what you're doing and why to the examiner. Read out the chart and explain what you are giving, what you're checking, giving, not giving, and why. Complete all the required drug administration checks. Complete the documentation and use the correct doses. The correct codes for non-administration are on the chart. Check and complete the last page of the chart. Are we together? So that's a second scenario. Then let's go into the how-to. So we get to wind up this. Okay. Okay. So let's assume the patient already knows you, but then you have to introduce yourself again. Okay, let's start. Hello, Jamira. Your doctor prescribed some medication for you, and I'm here to administer it. Okay. May I please confirm your name, date of birth, your address, your hospital number? The lady wants back. Do you have any allergies? Yes, no. Okay, Jamira, I'm going to prepare my medication and get back to you later. Okay, so this is the call bell. If you need help, just press it. Okay, then I'll look through my prescription and read out the name, date of birth of the mother. Remember, you have to read out the whole prescription, which I promised to do a video of the prescription chart, so that we go through it clearly. Okay, so you know what to read out. Remember, you have to read out, it's like twice or thrice. You have to read out every page, everything there. Okay, my patient is not on oxygen. She's a non-carbon. So let's assume my patient is in antenatal ward, and betamethasone 12 milligrams IM has been prescribed. Okay, the instructions present, so I'll go on and prepare my patient's medication, go to my immediate supervisor, and they get the key for the medication. I'll look at the medication trolley and see if it's ready to use. So I'll confirm with my examiner. Madam Examiner, can I confirm my medication trolley is ready to use? It's clean and and everything is well calibrated. Okay. Then, as you're preparing the betamethasone 12 milligrams, I'll look into my vial to see it's not broken. I'll check the expiry date. I'll get my syringes and also look at their expiry dates. So they're all in dates and not broken, and they're good to use. Okay. Then I'll get my blunt needle, withdraw 12 milligrams. Madam Examiner, can you confirm with me it's 12 milligrams? I'm having a vial of 4 milligrams per 2 ml. So I'll close the locker and approach the patient, wash my hands and close the windows for privacy, close curtains. Okay, I clean the injection site with 70% alcohol swab. That is if the injection site is not visibly clean. So I'll go on and reconfirm the name, Date of birth. Madam Examiner, I've confirmed I have the right patient, right prescription, right prescriber, and the right medication, the right route, the dose, formulation. Okay. Sarah, Jamira, I'm going to give you a betamethasone 12 milligrams as prescribed by the doctor, since we suspect that you may get premature labor. This will help you to produce a surfactant factor that will help your baby breathe on its own in case it's born prematurely. It's very safe for you and the baby. The side effects, it may give you a redness, pain on injection site, lightheadedness in rare cases. And do you have any questions before we go ahead? Okay. And then, is it okay for me to administer it? Oh, wait a minute before I ask it. Okay. Yeah, it's going to be given on your hand. Are you happy for me to give it to you? Okay. Which arm may I use? I will inspect the injection site for any signs of infection, eggy redness, bumps, or pain, and my injection site is clean. I don't need to clean it. So I will locate for the acronym process and give the injection. Remember about cleaning the injection site depends. So you may clean it or you may not clean it, okay? So, but you have to verbalize it. And then I'll go on to stretch the injection site for stability and insert my injection at 90 degrees manner, but leave 1 centimeter of the needle outside. I will administer the medication slowly, 1 ml per 10 seconds until convinced it's all administered. Then I'll wait for 10 seconds before withdrawing my needle. So I'll withdraw the needle very quickly and apply a cotton. I will make sure I don't massage the injection site, but apply gentle pressure. I will ask my patient if she needs help with help with anything, and if not, then I'll tell her to keep an eye on the injection site. If she sees it bleeding, please inform us, and also leave her in a comfortable position. Okay, Jamira, I have finished giving you the treatment. Someone else will be coming with another dose, so let me go ahead and do my documentation. So I'll go ahead and do my documentation and thank Jamira for being cooperative. Okay, so that's one way. Let me see. I had a second way still, but the main important thing is to wait. I've missed something important. Sorry. So after giving them, I'll ask Jamira, do you have any questions? Then I'll go on to discard my instruments in their specific containers. I'll discard the sharps needles in the sharps container. I'll discard the cotton in other bins and then clear away anything that I've used. I'll discard the PPE, then wash my hands. I doff off the gloves and the aprons. Then that's when I do my documentation and inform Jamira I'll be coming back later. Okay. So some other thing that we need to keep in mind is that when you're reading out the prescription chart, you should make sure you know the errors, the right patient, right prescriber, right prescription, the right drug, right route, right dose, right dosage, right time, right dates. What else should we go about? What else about basically that's it, is to make sure everything is in date and the method of administration. That's the main important thing. So thank you so much for watching. So thank you so much for watching the IM injection. Kindly comment if you have any question or clarity on anything. If you want us to do videos on certain things, please comment. I'll happily do them. Then if it's your first time watching, please subscribe. And if you're a returning subscriber, please thank you so much, and please share with your loved ones or those you know who may need this. Okay, thank you so much. I love you all. Have a blessed day ahead.